Good morning. We will get started in just the next 30 seconds. Hope you're staying warm on these chilly days. Good morning to those just joining. All right. Well, in the interest of time, we've got a lot to talk about today, and we've got some great guests on a panel today. So, again, we hope you're staying warm on these chilly days. I actually learned yesterday was the coldest February 19th in Denver history. So, uh, take that information with what however you'd like. Grab a cup of coffee, and we're excited to have you all today. Thanks again for joining. I'm Karam Ahmad. I'm CHI's Managing Director of Partnerships and Development. Should you ever have an idea on how we can collaborate, give me a ring. I'm the person that you wanna chat with. Um, Today's topic is our new work, really assessing needs for school-based health centers and looking at policies that can support these crucial clinics. We're gonna have plenty of time for questions, as always, and you can either use the comment button or the Q&A button for questions, and we'll get to those later on. Let's actually get some. We'd love to get some audience participation going right away. So, if you could drop your name in the chat field, and tell us where you attended elementary school. I went to Dunn Elementary IB World School, which is a mouthful. It was in Fort Collins. Go Dolphins. I don't know why a school in Fort Collins, Colorado was the Dolphins, but that's where I went. We can go to the next slide. So for those of you that may not be familiar with CHI or don't know really what we do, Colorado Health Institute is a nonprofit public health institute. So what does that mean? It really means that we help others who are trying to make good decisions about public health. We provide data and research, we provide guidance in making decisions, we evaluate how decisions get worked out. And we partner with community groups, with state and local government agencies, with foundations, providers, all sorts of groups. And we welcome any opportunity to discuss how we can support your work. Today, we're joined by some of those partners from government, from nonprofit alliances, and school districts. And actually, you'll see at the bottom of the screen, these are three pillars of answering critical questions. We make sense of complex issues, and we support others that are looking to reach those actionable solutions, like supporting kiddos in school-based healthcare. So we're excited to really jump into that today. And it's really cool to see all the schools and cities and states that people grew up going to. So thank you for participating in that. If we can go to the next slide. So in a time where data continuity matters the most, we'd love for you to join us for our next Hot Issues in Health webinar on March 27th, for what we're calling CHAZ Data for Changing Times. And the CHAZ, if you don't know, is our moniker for the Colorado Health Access Survey. It's our biennial survey. We've collected all sorts of health and social data on since 2009. It is a really rich data source. We'll explore using the CHAZ to look at when uninsured rates rise. So you're not going to want to miss that. And you can sign up for that using the link on the screen or the QR code. It's also on our website. So without further ado, I'd love to turn it over to our hosts at CHI Studios, Lindsay and Gerardo, who will introduce themselves, and then you'll hear from some really great panelists later on.
Thanks, Karam. Hi, everybody. I'm Lindsay Whittington. I am the Data and Analysis Manager at the Colorado Health Institute. I've been here for a little over 5 years, and I am now the Data Manager of the Colorado Health Access Survey, as well as one of our geospatial analysts on staff.
Morning, everyone. My name is Gerardo Silva Padron. I'm a policy analyst here at CHI. Been here a little over 11 months, 1 year in March. Prior to this, I worked in the education policy space. Through that, I fell in love with the connection of health and how It may have an overall impact on students and teachers, and that's when I became invested in school-based health centers. So um, happy to be here, and let's get started.
All right. So to get started on our content today, let's start by introducing everybody to what school-based healthcare is and why it is such an integral part of healthcare delivery for our kids in Colorado. So school-based healthcare in Colorado consists of school-based health centers that are healthcare facilities that are located within a school or on school grounds. As of February, there are 71 clinics that are operating across the entire state. These clinics served around 35,000 kids just in 2023. The clinics are also staffed with teams that can include medical and behavioral health providers, other specialists, dental professionals, care coordinators, and so much more. Some locations have services that are provided as school linked, which means that it's a smaller scale program that provides care outside the usual brick and mortar school-based clinic that people find in schools. This can include services that provide things like telehealth, mobile units, as well as single providers that partner to provide services to students and their families. School-based health centers are a really important part of the healthcare system as they often serve students and families who don't have the usual access to school-based healthcare usually. And so some of the key services that are provided at these really integral places for care can include things like well child visits, sick visits, other health screenings, lots of places where they can get immunizations, as well as mental health and other kinds of counseling, oral health screenings, substance use screenings, as well as reproductive health services, as well as other services. This is just a small part of what school-based health centers provide for kids in Colorado. School-based health centers also have been researched thoroughly and have been found to really link real benefits for children when they are accessing care in school-based health centers. This can include benefits like higher school attendance, increased graduation rates, fewer visits to emergency rooms and other kinds of urgent care centers, lower hospitalization rates with children who have asthma, better access to mental health care services, higher vaccination rates. And so these kinds of really integral services have really been shown to really increase the kinds of access that we're really looking for to make sure that kiddos have the kinds of care that they need when otherwise they might not be able to get these kinds of care access. So now we're going to explore an interactive data tool that CHI developed in partnership with the Youth Healthcare Alliance, which was formerly known as the Colorado Association for School-Based Healthcare, or CASBIC, as well as with the Colorado Department of Public Health and Environment. So CHI has worked for many years on different needs assessments that have focused on understanding the impact and the needs of school-based healthcare. However, in the last two updates, the needs assessment, we have transitioned actually into an interactive online tool that showcases what we have called the School Need Index. So this tool allows users to understand where there might be higher need schools for services across the state. And so we're going to walk through some of the kind of key findings of that index that we have found so far. And then we're going to do a demo of the actual tool together so people can see how to use it. So first off, let's kind of walk through a few key findings that we found from our analysis of the School Need Index. So first, school-based health centers, again, serve children and families who might not have access anywhere else. This is a really integral piece of how they can access services. We also found that Metro Denver schools with the highest need are often clustered east of the I-25 corridor, as well as rural schools, which include places like the San Luis Valley. They show higher need and oftentimes have limited access to existing school-based health centers. So before we explore the tool, I wanted to provide an overview of the methodology of the Needs Assessment Index that is presented in the tool that we're going to walk through together. So in the 2024 update, the index was developed based on 17 key health-related metrics, which we grouped into 4 focus areas. These metrics measure things like healthcare outcomes and risk, health insurance coverage, access and utilization of healthcare, as well as overall student need. So some of the examples of the indicators include things like the uninsured rate for youth, percentage of families that do not have a usual source of care, as well as the school dropout rate. So these metrics are available at different levels of geography, from the school to health statistics region. And so these data at larger geographies are applied to the schools within that geographic area. We have a more detailed methodology report on the tool that people can dive into if they're more interested. So after calculating the index is then grouped into 5 categories based on the natural breaks within the data. So these groups so on the left side, they start from highest need in red, and then in orange, we have higher need. In yellow, we have average need. In green is lower need, and then blue is going to define as lowest need. So you will see these colors on the mapping application that we will now explore.
Once you have a few minutes to adjust real quick, shows this cool interactive tool.
All right. So I wanted to start off by showing people, how they can navigate our online web page of where they can find access to the tool. So we have a landing page that matches the webinar title that we are going through today, Meeting Students Where They Are. And on this web page, you can find access to the actual tool itself. So if you scroll down, you can find the actual tool, and you can use the full screen version in order to pop out the tool so that you can view it full screen. So let's view that together. So once it's in full view, you can see the entire mapping application. And this mapping application is organized into a few key areas that you can navigate. So that first one is really introducing you to school-based health centers and what they are and their importance. And then there's how to actually use the index map, so some instructions on how to use the tool. And then there's a section of mapping need across the state, which shows the actual mapping applications, as well as that detailed methodology that I spoke about earlier. So if people are more interested to see all the 17 metrics and how we calculated the index, you can check out that methodology page. All right, so let's dive into the actual tool. So on the first section of the tool, we have lots of really rich information about school-based health centers, as well as some really great photos that one of our colleagues, Brian, took going out into the community and actually seeing the kiddos that are accessing services across the state. So when we first scroll down, the first map that we interact with is the actual map of the now current map of the school-based health centers across the state. So if folks are interested in viewing the actual school-based health centers and where they are, you can use this map to navigate across the state to see the different schools, the different centers across the state. You can use a search feature here up at the high left or the upper left-hand side of the map to navigate to a specific county, to a specific address that you want to see if there is a school-based health center in your community. So that's the first kind of tool that you can use on this application. So once you've kind of dove into the data that show where the actual school-based health centers are, let's now look at, understanding school need across the entire state. So again, this is kind of an overall description of how to use the application, which I will now walk through with everybody together. So when you navigate down, you can then see our larger school need access, our accessing need tool. And so one way I like to view it is also by viewing it in full screen. So if you click this little button here, it'll pop out the this entire tool into a new window so that you can use it in full screen. So once you've popped out the school need actual tool, you can view it like this. And this is some of the really cool features that the tool has. So on the right-hand side, we have a couple different features that allow you to filter the different schools as well as the different features of the schools across the entire state. So the first filter that I want to walk through is the filter by relative need. So these again are those 5 groups that I spoke about that organize the index into those 5 distinct groups to really understand low need schools to high need schools. So perhaps you're interested in just viewing the higher need schools as well as the highest need schools above that average of the index. You can easily click on the 2 filter settings to then only provide those orange and red dots on the map. So that's one way that you can use this tool to filter in and out information that you're interested in looking at. So in addition to the relative need filter, which is kind of designated up here as the little heart, the other filter that we have is designed here under the school icon. So if you click the school icon, a new filter will pop up that we can now use. So this filter is what is now the school characteristic filter. So now we can actually look at different kinds of schools, which are mapped here based on their need by different characteristics of those schools. So if you use this drop-down menu, you can see the different filters that are built into the application. So first, you can look at schools by urban rural status if their county is designated as urban rural. You can look at schools based on the percentage of students of color in that school. If that is a population that you are really focused on in your work, you want to see, what schools have higher percentages of students of color and what the need of that school is. You can also filter by overall student body size. So if you are in a rural area and you want to see, which schools have lower number of student body size, you can use this to kind of filter in and out of those schools. You can also check out if that school has a actual physical clinic, school-based health center at the school. You can look to see if that school has access to a virtual school-based healthcare mode, if they have telemedicine available at that school, as well as if that school has access to a mobile school-based health center kind of access, those two school-linked types of care that we spoke about earlier. So for example, I'm going to go ahead and use the student body size filter. So when I click on that filter, I now am prompted by a new drop-down menu where I can now look at the number of students that are at the actual school itself. So I'm interested, let's say, in schools that have 1,000 kids or more. So I click on that actual option, and then I click apply. And now we see that the tool actually filtered out the schools that have some of the higher density schools across the entire state. Not super surprising. We see a lot of them around the, general Denver metro area, around the Front Range, where we have a high concentration of population as well as along the I-70 corridor out to Grand Junction, which is one of the larger places out on the western slope. So that is a really easy way that you can use these filters to further, focus your search and focus the kind of information that you're interested in. So I'm going to go ahead and reset the filters so that I can see all the schools again. And I'm just going to walk us through some of those key findings that we mentioned earlier. So if I go ahead and kind of zoom in to a certain area of the state, so I'm going to go ahead and zoom into the Denver metro region. So just to kind of orient people, we see Arapahoe County, we see Adams County right here, and then we have Weld County here, just to kind of orient people around the state. So a really interesting finding that we found, this is also kind of similar to what we found in the previous index, is that we do see a clustering around when we see lower need and lowest need schools, as well as the highest need schools around the Denver metro area. So we can actually see that along the I-25 corridor, we see a split of lower need schools being on the western side of the I-25 corridor and some of the higher need schools clustering around the east side of the I-25 corridor. And we can see in the kind of Arapahoe Denver area, we see kind of a mixture of, those average need schools, highest need schools, as well as the highest need schools. So that's something geographically that you might not see if you're looking at a normal just paper needs assessment. This is one of the really big valuable adds of being able to actually look at these data across the state. This is a very striking finding just by putting the schools on a map and seeing how they kind of organize themselves around the school index that we developed. So in addition to some of the findings around the Denver metro area, I'll just kind of take us to some of the more rural areas of the state. So we're going to kind of look at the San Luis Valley region. So as we mentioned, we have several of these schools in the area are defined as red or orange, which is how we designate higher or higher need schools. And so in this area, we see that kind of showing up in these more rural areas. And there isn't as much access to school-based health centers in this actual region of the state. So that is an important way to be able to look at your area, your community across Colorado to really see, what the need of schools are and how you might be able to invest resources in different areas of the state. If you're interested in opening or figuring out where to put a new school-based health center, for example, or expanding some of those school-linked options as well. All right, so now we're going to take some suggestions from the audience. If there is a specific county, a specific community or municipality across the state that people are interested in checking out. So we're now going to, take some suggestions from the audience. Go ahead and plop in a certain community in the chat that you might be interested in us investigating on the map today. Okay, we got Weld County. Okay, we'll start with Weld County. Thank you for providing some examples that we can check out, everybody. So up in the school, or excuse me, in the search bar at the upper right-hand side, you can easily type in a county name like Weld County and click on the search option and it'll navigate you to that area of the state. And so when we zoom into Weld County, we can see how there is kind of a difference in the school need across this region of the state. So when we see it compared to its neighboring county in Larimer County, we see a little bit differences. As we kind of navigate around the Greeley area, we see some average need schools in the yellow popping up. But as you move west in Weld County, when you get a little bit closer to Windsor, get a little bit closer to Fort Collins, you can see there's lower need and lowest need schools in the blue and as well as the green. But you wouldn't see that difference when you're just kind of looking at these schools by themselves because it's mapped. We can really see how there is a clustering of slightly, average need schools versus some of the lower need schools as you move west. So yeah, thank you for that example. I do see a question in the chat about, is there a way to overlay to show where the school-based health centers are in the counties? So that's kind of why we built in that filter setting here. Again, you can see the schools that have the different schools that have access to different kinds of care. But right now, this map doesn't have an additional layer that also overlays the school-based health centers. So that's where that first map is. But that's a good question. So you can use that first map to see where the school-based health centers are. And then this map allows you to filter based on access to those different school-based health centers. But yeah, thank you for the question. All right, we also have Aurora. I see Aurora in the chat. All right, let's take this one last example. All right, so if you Google Aurora, Colorado comes up in Arapahoe County. It'll navigate you to Aurora. And when you zoom in, when you get a lot closer to, this kind of community level, so here, just to kind of orient people, we have Colfax here on kind of the north side of the map. We have Aurora here labeled in the middle, and then here's kind of the spread of how we see just at the community level, how school need can really look different across a specific area. So then here's Colorado Boulevard, just as an example of kind of the boundaries of a community in Colorado. So here we see kind of in the central area, we see some of the more higher need schools, but as you move west in this community, you see a little bit more average need as you move west towards Colorado Boulevard. So just within this small area of Denver, you can see the difference in how this community schools have different kinds of access, different kinds of, unique qualities that might make it more likely to be a higher need school. So we even see some lower need schools here a little bit north as well. So yeah, this is a really good example of when you have lots of schools in an area, you can really see the variety and kind of the differences in just a small area of, for this example, Aurora, how it might look different based on what school you go to in one specific community. All right. So that's what we have as kind of our demo today. We're going to shift it back over to our presentation so Gerardo can take us through some really important policies that Colorado has, as well as other states.
So we're gonna get started. Thank you so much, Lindsay. That's a great interactive tool. Um, Good morning, everyone. Thank you all for being here today. My name is Carlos Padron. I'm excited to discuss a critical aspect of student well-being, that being school-based health centers and the policies that shape them both here in Colorado and across the nation. So in Colorado, we have made significant strides in expanding and supporting school-based health centers, thanks to state policies that prioritize access to healthcare for students. However, when we step back and look at the national landscape, we see a variety of approaches. Some states lead the way with robust funding and policy support, while others face challenges in implementing and sustaining these essential programs. Today, we'll explore the current policies governing school-based health centers, the successes and challenges within Colorado, and how other states compare. More importantly, we'll discuss how leveraging schools can be essential to students' health and well-being. So let's get started. The incredible team at the School-Based Health Alliance recently launched a new campaign called Keep Healthy Together. This collective effort highlights the importance of school-based health centers nationwide and supports healthier kids and strong communities. As part of this campaign, they compiled a valuable data resource for us, including a map of all the school-based health centers across the United States. One key thing to note here is how school-based health centers are widespread across many states. And this may be because several states have statutory measures in place that allocate dedicated funding to these centers. For many centers across the nation, funding can come through many ways, such as federal and state grants, healthcare institutions, private grants, and in some states, they have even tapped into their Medicaid reimbursements to expand and sustain school-based health centers. This national map also showcases the remarkable growth of school-based health centers in Colorado. Since the state's first school-based health center opened in 1978, the number of children with access to these essential health services has reached an all-time high. As of 2024, Colorado has a little over 70 school-based health centers operating across the state. In Denver alone, Denver Health manages 19 school-based health centers located within Denver Public Schools, which serves about 15,000 students annually. So now let's dive into another issue that school-based health centers do a great job of addressing, and that's children's mental and behavioral health. Our most recent 2023 CHAS survey examined the mental health of school-aged children ages 5 to 18 by looking at the number of days they experienced poor mental health in the past month. In 2019, 9.6% of school-aged children reported experiencing 8 or more days of poor mental health in a month. By 2023, that number had jumped to 16.5%, a significant increase. It's apparent that the COVID-19 pandemic had an impact on children's mental health and overall well-being, thus forcing many school-based health centers to think more critically about how to deliver mental health support, such as looking into telehealth and video services. On top of the great work that school-based health centers are doing in Colorado, the General Assembly last year voted to permanently continue the iMatter program. For those that may not be familiar with the program, this initiative originally launched during the pandemic. It provides up to 6 free telehealth or in-person counseling sessions to students from elementary through high school. These are both examples of how schools are becoming critical access points for quality mental health care and how school-based health centers and Colorado policies have played a major role in supporting students beyond traditional medical needs. Now we're going to transition to some notable policies that have impacted school-based health centers. So over the last a few years, Senate Bill 22147, which was enacted in 2022, it allocated $1.5 million in federal stimulus funds for the school-based health center grant program, which expanded access to behavioral health services for children and families. More recently, last year, Senate Bill 2434 passed. This bill expanded the definition of school-based health centers to include school-linked healthcare services. This allows for grants to support services such as primary care, behavioral health, and oral care to be delivered through telehealth, mobile units, or referrals to clinics near school grounds. A little bit of a quick rundown on what schooling services are. Think of schooling services like a helping hand from the school to connect students with doctors, dentists, therapists, and other healthcare providers outside of the school. Instead of having a doctor's office inside the school, like what you see in a school-based health center, the school helps students get care somewhere nearby, like a clinic, hospital, or through telehealth services. School administrators and other school staff members tend to be the ones fostering these partnerships between students and their needed service. But to wrap us back to the bill did pass, but did not receive its overall goal for funding support. However, it did expand the state definition of school-based health centers by broadening the scope of accessible healthcare services by incorporating school-linked models. Another issue that school-based health centers do an amazing job of addressing is oral health. Oral health can significantly impact a child's school studies and their willingness to engage in the classroom. Poor dental health can lead to pain, infections, and difficult eating, which has an effect on a child's nutrition and overall well-being. A national study found that children collectively miss about 34 million hours of school each year due to dental pain. For instance, ongoing dental pain such as cavities, infections, and gum diseases can affect a student's ability to concentrate throughout the school day, leading to a reduced ability to perform academically, which may result in more absences from school. In Colorado, 6.5% of school-aged children reported having fair or poor oral health in 2023 based on our CHAS survey results. School-based health centers work hard to bridge the dental care gap by providing students with preventative and urgent care cost or services at no cost. These centers offer screenings, routine cleanings, cavity prevention, and x-rays, ensuring timely oral health care. By prioritizing school-based dental care, it promotes healthier kids, academic success, and it's also a safety net for families that may not have insurance, access to transportations to set appointments, or afford quality dental care. In addition to these amazing services being offered to families and kids, Colorado last year also passed a bill, Senate Bill 142, that will be piloting an oral health screening program in some schools. This type of program can help address disparities in dental care access, especially for families facing financial or logistical barriers. Thus, by integrating dental care into schools, Colorado's taking a crucial step toward ensuring all children have received preventative and needed dental care. Now, we're gonna look at a few examples from other states. While Colorado excels in school-based health centers in other states have developed unique programs tailored to their community's specific needs. No two centers are the same. Each provides distinct services designed to support their local populations. Let's get started with our folks down south in Louisiana. Louisiana school-based health centers collaborate with dental providers. When it became apparent that the dental workforce shortage would be an obstacle, additional training was given to advanced nurse practitioners to perform focused oral health assessments, apply cleanings, and even refer students to dentists. Next, to our folks more on the west, South Dakota, in rural South Dakota, school-based health centers address the dental care provider shortage by engaging with medical and dental hygiene students, along with the professors. These teams travel to rural schools, delivering oral health education, screenings, and services. This hands-on experience not only addresses the provider shortage, but by giving students an opportunity to learn, but also aims to reach the children in underserved rural communities. And lastly, for our folks more up north, Oregon's school-based health centers offer a wide range of preventative services, including well visits, behavioral health, youth sexual health, and opportunities for youth to engage. To elaborate a little bit more, one of Oregon's most innovative approaches is student involvement. The state empowers the youth through their mental health youth advisory council grants, which have a goal to reduce stigma and promote mental health awareness for the younger population. These student-led advisory councils collaborate with school leaders, policymakers, and organizing listening sessions to identify and address barriers that other students may be experiencing. Through these listening sessions, they directly impact policy. A lot of these sessions and the input from those result in policy changes in terms of the certificate standards that school-based health centers need to achieve to open up. And that concludes the policy fun part, and I'll transition it back to Lindsay.
Well, thanks, Fargo, on that really great explanation of some of the key policies that we see, not just in Colorado, but across the entire country. So now we're going to open it up to chatting with some Colorado experts in this space. So we're really excited to introduce our four panelists that we have joining us today. So first we have Aubrey Hill, who is working at the Youth Healthcare Alliance. We have Michelle Schultz, who is from the Colorado Department of Public Health and Environment. We are also joined by Monica Icasa, who is from Mapleton School District, as well as Wendy Murillo, who is from the Center of Consolidated School District. Sorry. So now we're going to open it up to our panel with some questions that we have for folks. Okay. We're just transitioning so we can get folks up.
A few questions.
All right, we're live. All right, sorry. All right, well, welcome everybody. We are really excited to chat with you all. We really appreciate you joining us today. So first off, I would love to hear from our panelists about some of the really important work that you do in the school-based health center space. So if you want to kind of introduce your role and, kind of the history of your role in the school-based health center space. Aubrey, if you want to kick us off.
Sure. Hi, everyone. I'm Aubrey Hill. I'm the Executive Director of Youth Healthcare Alliance. We're formerly the Colorado Association of School-Based Healthcare, and we are the membership organization for all of the school-based health centers in Colorado. Right now, we have 71 all across the state, and we are the champions for school-based healthcare. So we advocated the state legislature, and we also reach out to new communities to ensure that they know what school-based health centers are. If that's an option that they want to pursue, we support them in exploring that. We have a couple of people on the panel here who are in the middle of that right now. And once a school-based health center is established, we are there to provide technical assistance and support for our clinical services. This organization has been around since 1996, and we are very much driven by community partnerships to advance school-based healthcare in Colorado.
Yeah, thanks, Aubrey. Michelle, do you want to go next?
Yeah, good morning. I'm Michelle Schultz, the School-Based Health Center Program Manager at the Colorado Department of Public Health and Environment, and I'm thrilled to be here today to talk about school-based healthcare in Colorado. I've been with the State Health Department for over 8 years. I joined the School-Based Health Center program in fall 2020, which was a little bit of a tenuous time to jump into this world. But I really fell in love with the program model and the it's super engaged stakeholder community in our state. A little bit about our grant program. It was established in state statute in 2006 and placed at the Colorado Department of Public Health. Our program provides grant funding from the Colorado General Fund to support planning for new school-based health centers. So providing some seed money for that capacity building and needs assessment, exploration, et cetera. And then most of our grant funding goes to help support the operations of currently operating school-based health centers. The program funds a majority of those 70 some school-based health centers that Aubrey mentioned. Right now, we are funding 4 sites in the planning phase and 57 operating sites. And this funding is directed to schools or sites that are serving predominantly low income, underinsured, and uninsured students. So when looking at that CHI map that we just saw, a majority of our funded sites are in those higher need designated schools. So I'm here to answer any other additional questions about our grant program and the support in the state.
Thanks, Michelle. Monica, would you like to go next?
Sure. Hi, everyone. Thank you for having me. I am Monica Icasa. I am the nursing administrator for Mapleton Public Schools. So we're located halfway in Denver, halfway in Thornton. And We are in the second year of planning through the School-Based Health Center grant program with CDPHE, and we've been working really closely with Aubrey and the Youth Healthcare Alliance. I guess my work kind of has revolved around bringing resources. Sorry, my light turned off. Bringing resources to our, just at the right time, to our community who is largely uninsured, underinsured. We have a pretty high immigrant population as well. 80% plus of our student body is Hispanic, Spanish speaking only. So there is a great need. So I feel like the majority of my job and my work goes into connecting our community with resources. So yeah, that's what I
Thanks,
do.
Monica. And
Thanks.
last but not least, Wendy.
Hi, everybody. I'm Wendy Murillo, and I'm the district nurse at Center School District in the San Luis Valley. We're in the early stages, but we are hopefully getting a mobile-based clinic starting next school year. We, like Monica, have a very high need population. We're in the San Luis Valley. So yeah, that's me, and that's where I'm at, and thanks for having me.
Yeah, thanks everybody for those great introductions and the amazing work that you all do. So one of the first questions that we have, if Aubrey, you want to speak to this first, perhaps, is what are your top priorities, let's say for the next 4 years, as we're kind of looking forward, what is your organization's kind of top of mind issues as we're moving forward?
Yeah, I think in the next 4 years, we have a few defensive and proactive priorities. Speaking to defense, Medicaid and CHIP are critical for school-based health center income. They bill insurance just like any other healthcare provider's office. So Medicaid and CHIP takes up the majority of the revenue that they have. And as most people in the healthcare space are aware, the Medicaid unwinding from the public health emergency has caused a lot of folks to disenroll from coverage, even though they may still be eligible. And that means a lot more folks are showing up into care spaces uninsured. So it makes it really critical for clinics like school-based health centers to rely on other funding sources, which is scarce, frankly. And that really hurts the bottom line and their ability to stay open. We saw this last year when 2 school-based health centers in Basalt, Colorado closed due to these shifts away from Medicaid and into uninsured. So our defensive priority right now is to correct that change and see how many more people we could get enrolled into coverage so that way we can support the revenue needs for school-based health centers. And we really want to make sure that no more clinics are closing. And proactively, we are continuing to reach out to new communities that are in need or potentially could benefit from school-based health center. And our focuses are in the San Luis Valley, where you saw on the map, there's a high relative need right now. So we are reaching out to great leaders like Wendy and trying to make those connections to see what we can do. And I think in some of these areas, school linked might be a better fit since the communities are smaller, but the need is there. So we want to provide some opportunities for that presence within the school to start providing some outside to find other services. And as we do this more, we get better at it and we can inform the CDPG grant program for future funding possibilities. With all of the conversations that we're having in communities, we do see a great deal of interest in pursuing school-based health centers. And we always want to make sure that the state resources are there and available to support those programs. That's really critical. And the CDPG SBHC program funding has not grown in over a decade. So we continue to advocate to the legislature to think about a gradual growth process for the program, just a little bit each year, but really a long way in supporting additional grantees. And we want to make sure that anytime we're going out into the community, that the resources are there. So that's a big priority for us.
No, thanks, Aubrey. Aubrey, I have a quick follow-up question to that is, do you know what percentage of the funding, as kids are accessing programs that come from Medicaid or other federal dollars?
In the past, I believe it was around 60%.
Wow.
Wow.
I don't know what that would be with the changes to the program.
Right. No, yeah, thank you. Also want to open it up for other folks. It's like, as you're moving forward, we know that Monica and Wendy, you're working on expanding access in your communities. If there's anything else that folks want to talk about, or Michelle, like around the grant program, perhaps as you're kind of moving forward in the next 4 years, want to open it up to everybody else too.
I could jump in and share a little bit about where we are in our grant program. We are in year 3 of a 5-year cycle. So right now, our priority is supporting our current grantees, helping them collect data to demonstrate their programmatic impact, and also exploring how school-based health centers can utilize telehealth in new or different ways to expand access to care. But we will soon be starting to plan for our next competitive cycle. So we're in year 3, but we'll be releasing our next competitive application, tentatively released in fall 2026. And so we already are starting to plan for what we will include and how we will include school-linked care in that future model. So we're really excited to have the data and mapping tools that you described earlier, so that sites and communities across the state can start thinking about how, where their community fits and how they might apply for that grant program in just about 1.5 years. So it's not that far away.
Yeah, thanks, Michelle. That's super great information, especially for folks thinking about, how they might interact with the grant program. Wendy or Monica, anything you'd like to add to kind of what your top of mind issues are moving forward?
Sure, I could speak to kind of our personal experience. Our biggest hurdle right now, we already conducted a needs assessment and found that there is a pretty big need in our district, our community. Right now, it's finding the funding for capital improvement specifically to be able to repurpose a an existing building and open an actual clinic. We found that not just our community, but our board would prefer like an in-person brick and mortar, face-to-face interaction with the practitioner versus telehealth, which telehealth is not off the table completely. It's just a preference that we might have to set aside if we are not able to collect
It's
the
interesting.
amount of capital that we need. But right now, that's kind of been our biggest challenge and my biggest focus this year.
Yeah, thank you, Monica, for that, that perspective as you're kind of working through opening a new center. I can move us to the next question, which, kind of post-COVID funding, some of the information that Gerardo showed about some of those federal dollars that came in because of COVID. As we're kind of, in the post-COVID world of funding, how has, service provision changed, or how has some of that, kind of what you mentioned, Monica, around the telemedicine issue, like, has there been any changes in how services have been provided after COVID and some of the kind of focuses?
I can jump in on this. I can speak a little bit universally to what we heard from multiple school-based clinics around Colorado. So we heard that even in 2 or 3 years out from COVID, they're still playing catch up with child visits, developmental screenings, and immunizations. They're saying, oh, catching up to date, that is happening. And I will also speak to telehealth a little bit. School-based health centers quickly pivoting to incorporating telehealth into their routine services. That with the generation they're serving, the familiarity they have with technology, that they will be really comfortable and prefer telehealth that turned out not to be the case in many of these areas. They actually wanted that in-person interaction with providers. So we've had to pivot again to not emphasizing telehealth too much from these communities.
No, yeah, thanks, Aubrey. That makes sense. Where it's like we're kind of seeing that pivot. Monica even kind of mentioned that, the pivot to how do we balance, these increased services that we had because of COVID, but also this focus on providing in-person care. That's very interesting to hear from you all about that. Some of the next questions that we're interested in is kind of, have there been any challenges or successes kind of during the process of trying to open a new school-based health center? Looking to Monica and Wendy or Aubrey if you've heard any other stories as well. What's that experience been like?
Speak to that. One of the big advantages I feel has been the connection to organizations in our community. Um, we've just through networking, right? Just through connecting through the school-based health center avenue, but we've been able to connect our families with vision care. That was a big need that we had. I know that the county, Adams County specifically, has kind of revamped their immunization clinics. That's a big need in our community. We've been able to connect our community with Kids First Healthcare, who doesn't turn anyone away basically for healthcare in order to get our kiddos their physicals, their immunizations, their well care, any sort of reproductive care as well, just kind of like an opening to get our kiddos, even with chronic diseases, into a primary care provider and then be able to receive more specialized care for, whatever illnesses, diseases they're dealing with. But I just find that it's opened kind of our eyes to the programs that are out there currently that we can connect our families to prior to opening a clinic in our district.
Yeah, thanks, Monica. Wendy, anything specific from the San Luis Valley?
I would say, like Monica, we partner with a lot of organizations, and we have since I've started here 9 years ago, but they're not from the San Luis Valley because a lot of organizations in the San Luis Valley don't have the capacity to come into the school and do the dental screenings and do the vision exams. So a lot of them are coming in from Colorado Springs, Denver to do our screening. So while it's super beneficial for our students, like I'd like to use local partners if we could. It's just not really feasible at this time. And then our biggest hurdle, kind of like Monica, we must be in the same boat here, but is building a brick and mortar building to have our clinic in. Our school was funded by BEST like 12 years ago, and we built per square feet of our students enrolled, and our student population has grown. So we are just outgrowing the school as it is. And so of course it's an educational system. So we need classrooms before we need a health clinic. So it's been my goal since I've started here to get one, but it's always on the back burner, it seems like. So we're excited to get a mobile clinic in here to, just for the time being, and see what we can do in the future.
No, thanks, Wendy. No, that shows kind of the importance of those school linked, where that could be something to fill the gap before you're kind of working through this brick and mortar kind of issue, trying to work through that with your area. Okay, so now we're going to transition to some of the audience questions that we have. So from one of our audience members, they were curious, do school-based health centers in Colorado also serve as workforce development programs to mentor and teach students who are interested in healthcare careers?
I'll take that one. Generally, no, just because these little communities are so small that it's really hard to preserve confidentiality. If students from the school also work at the clinic, you can't really keep that care confidential from their peers. So we don't do that generally. But there is a special project that Youth Healthcare Alliance is working on. in partnership with our national partners in Gateway High School, where we're just working with the students in the school, specifically Black students who are interested in going into healthcare fields, and supporting them with connections with other professionals who are well set up in their fields, and showing them the pathway to get into that desired profession. That's a little bit separate from the school-based.
No, that's great. Thanks, Aubrey.
I can speak a little to what we're doing at the state level. The school-based health center program team is trying to plug into other school health professional, school health workforce development fields just to raise awareness of the school-based health center model and a pathway for clinicians and behavioral health providers, therapists, et cetera, that are interested in working with school-age youth. Workforce has been generally one of the challenges over the last few years post-COVID. So that is one area of priority that I neglected to mention earlier.
No, thanks, Michelle. This is great context, for Colorado. A couple more questions. Let me check this out. A question from Kelly. Who are the best advocates for school-based health centers in our current legislature, and how many of them are best encouraged or supported to increase funding in school-based health centers?
We have quite a few advocates in the state legislature right now. The first ones that come to mind are the sponsors of our bill last year, Senator Janice Marchman and Representative Lorena Garcia, and they continue to be advocates. The big challenge that's going to come into no surprise to everyone is the budget, as the CDPG school-based health center line item draws from the general fund, and that is pretty tapped out and at a deficit right now, and might be for the foreseeable future. So as we have those conversations, we need to get creative about where we can pull together multiple sources of funding to make it work for the clinics themselves if growing the school-based health center program is not an option. And I will also say there are a few members in the Joint Budget Committee who are advocates that always.
Thanks, Aubrey. So let's see, maybe one of our last questions perhaps for our panel today. Again, thank you so much for your perspectives and everything that you've shared so far. So we have another question. Looking forward, are there any predictions for how the new administration might cut or support this funding?
I think at this point, the biggest concern would be changes to how the Medicaid program is funded. If it goes to a block grant or something less than how it's being funded right now, that would be a big concern. As I mentioned before, school-based health centers rely on those Medicaid dollars to provide care. So I think that would be the biggest concern. Right now, there's not a huge pot of money that goes directly to school-based health centers outside of the community health center funding that goes to the community health centers that support some school-based health centers. That will be another concern as well. Hard to say where that's going to go.
No, thanks, Aubrey. That's a great perspective. And we really appreciate you sharing, kind of your thoughts on this, ongoing issue that we will face, moving forward. Joe, do we have time for maybe one more question? Okay.
Do one.
Yeah, let's do one more. So we have a question from you. Do you want to?
Yeah, I just want to ask, going into 2025, what are some maybe excitements, concerns from everyone? I think the audience would appreciate, what's looking forward to this new school year coming up.
Sorry, I can start. I'm just looking forward to getting the mobile clinic here and getting our students utilizing it. We're going to start in the fall, hopefully. And with our population, a lot of times the school nurses are the primary care providers. The students don't want to go to the doctor in fear of deportation and a paper trail. So a lot of times they're coming to us for everything. So I am super excited to get a clinic here with people they already trust, on site so we can serve them better.
Yeah, thanks, Wendy.
I agree, Wendy. I see that someone kind of asked how access might change out of
Mhm.
fear of because of their immigration status. I I wonder the same thing. Historically, schools in our school districts have always been kind of a safe space, and we've always been able to guarantee our parents that no, their info will not be shared with anyone. I still see parents trust trusting the district. Our enrollment hasn't necessarily changed too drastically, but it's definitely a concern that we have and don't really know the answer to long term. Like, unfortunately, that's not something that we can predict because it is volatile, right? It might change, in a month or two, but
Mhm.
we still see our community trusting the district and trusting us with their information and any sort of care that we provide to their kiddos. So hopefully that remains that way.
Yeah. Yeah. Thank you both, Monica and Wendy, for providing that. I think this just speaks to the importance of school-based health centers and schools as our access point, as well as a trusted place in our communities for kiddos and families. So we are at our time with everybody today. I just want to
Yeah.
again say thank you so much for the four of you, coming to this conversation today with all the different experience and your perspectives that you have and all the great work that you do to really expand access to services for kiddos across the state. So yeah, thank you everybody for joining us for our webinar today. Feel free to reach out to me or others at CHI for additional questions on the school-based health need index, as well as additional work that we have in this space. But yeah, thank you everybody. And I hope everybody has a great rest of their Thursday.